it's Cecile.
And Todd.
And today we're going to talk about my breast cancer journey, both me and point of view of it, and Todd will give his journey with it as well.
As a caregiver.
Stay tuned. There's a lot of pictures, a lot.
It's a lot.
It's a lot. There is a lot. Hi, everybody. So I'm going to go ahead and talk to you about my breast cancer journey. And I'll just start off with the date. So it was November the 10th, 2017. And I went for my annual mammogram like I always do. I was very cognizant of that because my mother had breast cancer when she was in her 60s. So ever since then, I had always been very, good about getting my screenings. So I went for my yearly screening. That was a Friday. By Monday, my doctor's office had called me and said, there was something they found on your screening. You need to go back for additional views. So I went back on, that was Monday, so it would have been the 13th. So I went back on the 13th to the diagnostic center, and they did additional views and said, we need to, you need to go to the ultrasound room and get an ultrasound. There's definitely something there. So I'm sitting there just really, really nervous and thinking, wow, really? I mean, can this really be? I had doubts in my mind, but then I also had, I thought, what if it is cancer? So I had the ultrasound, and I remember the ultrasound, it was the actual radiologist did the ultrasound, and the look on her face was not very, she was very concerned and very, she had a very serious look on her face. And I said, is there really something there? And she goes, yeah, there is, and she even had me take my hand and feel where it was. And I said, how did I miss that? I mean, I did the self breast exam, and I was almost, embarrassed because I'm a registered nurse, here we go. But, anyway, so she said, it looks very, very concerning to me. Let's go ahead and do a biopsy. So they immediately got me right in for a biopsy right then that afternoon. So I had the biopsy done, went home, and just couldn't believe, that this was happening. I kept thinking to myself, how could this be? I mean, what are the chances, really? I mean, why, how could it really be cancer? So then I had to wait, that was the 13th. By the 15th, my family doctor called me on the phone and told me that it was cancer. It was breast cancer. They didn't know what kind of cancer it was. It hadn't been through the full pathology, but they knew that it was cancerous. So I was thinking, okay, I had a few friends that had breast cancer, and all they did was, they had their mastectomy, had a lumpectomy, and was done with it. I was like, okay, let's get this done. Let's get that over with. Let's just get rid of it, So I had an appointment, I believe it was the following day, or within the next couple of days. I had an appointment with my breast cancer surgeon, and she, by that point, all the pathology had come through, and so she had told me what kind of cancer it was, and she said that I was going to need chemo. My husband was with me. I lost it. I was devastated. I was I was in tears. I lost it. I had a complete and total meltdown. because I didn't want to do chemo. I was thinking, here my son had just proposed to his fiance. They were going to get married in May of 2018, and I'm like, why now? I was a healthy person. How could this happen to me? And what kept going through my mind was, how in the heck did I end up with breast cancer? How the heck did that happen? Why me? Why me? And I was especially thinking, why me at this time in my life when there's so much going on with my son getting married, with all this happiness going on? Why does this have to happen to me? And then I started thinking, why not me? It's 1 in 8 women, folks. And breast cancer doesn't choose its victim. But how am I going to get through this, with a wedding, ahead, 6 months, 8 months ahead? How was I going to do this? So I got composure a little bit. And I remember they took me into, she wanted to check my lymph nodes. So she did an ultrasound of the lymph nodes and determined that there was nothing in the lymph nodes at that point. They actually can't tell until later when you have the actual surgery to remove everything. But for that moment in time, there was nothing in the lymph nodes. And I was just so thankful for that. So I met with my nurse navigator, and she went through with me, how often I was going to get this chemo and what kind of side effects, and stuff, and how I was going to get through it, and that I was going to get through it just fine. And, the thoughts that were going through my mind was, how am I going to work? How am I going to do this with the wedding? And I'll never forget my nurse navigator. She's looking through her calendar and she's like, so when's the wedding? And she looked and she's like, yeah, you can do this. You'll be fine. It'll be fine. You'll be able to do this. The chemo was scheduled for once every 3 weeks, six rounds. So every 21 days, I got a treatment. So before you knew it, I was in the outpatient surgery center getting a port placed. And that was November the 30th. So that was within 2 weeks. I had met with an oncologist prior to that as well. So I had a breast surgeon, an oncologist at this point. So the oncologist told me what to expect with the chemo. I had nurses tell me, what this is going to happen, side effects and so forth. So I had my port placed on November 30th. And then my first chemo treatment was November 30th of 2017. And it took all day long, pretty much all day. So that first day, I felt fine, came home, no problem. The next day, I was fine. But by Saturday, that was on a Thursday. So by Saturday is when this, it just kind of hits you like a ton of bricks. The most prominent side effect for me was the fatigue. It was just awful fatigue. I just, couldn't get up and move, basically. I mean, it was very difficult, almost like you would lose your breath trying to move around the house. So I would say that Saturday, Sunday, and Monday were my not so good days. It started getting a little bit better at that point, and then by maybe Friday or Saturday of the following week, so about 7 days, I started feeling normal, if you want to call it any kind of normal, to the point where, I could do things and function. Mind you, though, I worked my job through this whole treatment. I did take off the Monday following my treatments. I work from home, and I was very blessed to have, I work for an insurance company. I don't know how I did it. Like I said, I did take off Monday, but the rest of the week after, I still felt, kind of crummy. My appetite was not so good. I felt kind of nauseous. Just the fatigue and the poor concentration and just, You just don't feel red hot. They tell you that it's like flu-like symptoms. So I had 6 treatments of chemo, and in the middle of all that, I did catch the flu. And that was the year that the flu was really, really bad. I did take a flu shot. So that was fun. Not really, but actually I did pretty well with the flu, considering the fact that my immune system was not so good and affected by chemo. I had maybe 2 days of just feeling crummy. And I kept thinking, you know what? The flu isn't so bad. Chemo's actually worse. During this whole time of chemo, I went to my daughter-in-law's bachelorette party, traveled up to Wisconsin for that, had a great time. I had a wig. I lost all my hair. I actually lost all my hair, I think it was in December. So I had shaved my head, but most of it came off, I think, after the second treatment. I was also in the hospital over New Year's Eve for a blood clot in my lungs, and they said that was due to the cancer. I was actually going to throw our annual New Year's Eve party that year, because it was on a week where I was feeling, you know, pretty good. It would have been like the week after chemo. So I woke up with a fever, and I was told to go to the hospital or call the doctor on call. I woke up with a fever, didn't quite know what was right. My doctor told me to go to the ER. Went to the ER. They said, yeah, we have to kind of rule out an infection. Your white blood cells are very, very low. They found this blood clot, little tiny blood clot on my lung, and said that, well, you know, that was due to the cancer. So they kept me for 2 days over New Year. So that was another thing that happened during this whole chemo treatment time. So fast forward a little bit. Then in April, I threw her a bridal shower here in my home, and that went well. I was tired as hell, but I did it with every ounce of energy that I had. I did it, and with a lot of help from my friends and my husband and my mother, and everybody pitched in. So that went very well. My son and his wife, they got married May 5th of 2018. We went up there for the wedding. I felt fine. I was feeling much better, put it that way, than I had in months. I had a wig, I had the dress, and we all had a wonderful time. It was a wonderful wedding. I was just blessed that I was feeling well enough to do this and that everything was going to be okay. My surgery was May the 15th. I had a left mastectomy. Everything was clear in all the lymph nodes. I had no cancer whatsoever in any of the lymph nodes, and everything was clear when they did the surgery. And then I had my reconstruction. That took a few months. You have to go through like expanders, and then when those have to sit for a couple of months, and then you have your final exchange surgery. That was in October of 2018. Just a little side note here, right after my mastectomy, about a month later, my husband broke his leg, and so I was kind of having to take care of him and take care of me as well 4 weeks after surgery. But like I said, the surgery did not get me down, really. Maybe just for a few days, and then, you know, I'm kind of a tough person. You know, I bounce right back. He broke his leg. He was on a walker for like a couple of months, and it was just a horrible summer. My mother was in the hospital all summer long because we thought she was on her deathbed at one point, and then she wasn't on her deathbed, and she started recovering, and She spent from June until September in and out of the hospital and in and out of rehab places. So finally by September she came home. I had my final surgery in October, and that was to put the implant in. I actually still had to do these infusions. I kind of left that out. After my chemo, I had these immunotherapy infusions. My breast cancer was triple positive, which means it was estrogen and progesterone positive, which means that those hormones feed the cancer. Plus, it was HER2 positive, which meant that I had to receive these immunotherapy infusions every 3 weeks, continuing. After I was done with chemo, I still had to do these infusions every 3 weeks. Now, mind you, these infusions were a piece of cake. No side effects, nothing. And those continued for a full year. So I was done with those infusions in November. I still had my port through November. The final surgery was in October. Everything was good after that. That was in 2018. So I have been through, let's see, how many years now? Almost 4 years ago, this is when I was diagnosed. Now, let me tell you something else. The survivorship, breast cancer survivorship, there's a little bit of anxiety that goes with this. Now, I don't want to say that I'm constantly thinking about, recurrence or, things happening like that, but it does cross your mind. It is real. You try not to think about it. But, when you have your yearly exams, your yearly scans, your yearly imaging, your follow-ups with your doctor, you start thinking, it just makes you think about it again. Just recently, my doctor was kind of watching some spot on my rib for the last year and last 14 months. I've had 2 PET scans and 2 MRIs in the last 14 months, and everything's fine. So she just thinks it was some sort of surgery trauma. But the anxiety that goes with it is unreal. It's, you think about it happening again. But all I can say is that I survived it. I was tough. I was strong. I got through the chemo. It wasn't easy. Just everybody's different. And like I said, I didn't have horrible side effects. So I was good. So as a closing note, I just want to encourage any of you out there who have been recently diagnosed with breast cancer, whether you have to have chemo, whether you have to have radiation, so whether you have to have surgery, whether it's just a lumpectomy, I want to encourage you and just tell you to fight and get through it, and you can do this. You've got this. You'll be fine. Once you get a treatment plan, you'll feel better. I was a basket case until my doctor kind of told me that what was going to happen and how many chemos I was going to have. That's when you start feeling better. And that's when you know that you're going to get through this. So for anybody out there who's going through it, just stay strong and fight through it. And you can do this. Pink Sisters, you guys got this, really. You do. You don't think you do, but you do. Until later. Bye.